Hey guys, Ty and Sky here from Ty and Sky's Health Pub, and we are looking for the health topics that matter to you. Follow the link to submit your ideas and we'll get them covered as soon as possible.
Have a good one.
Hey everybody, Ty and Sky from Ty and Sky's Health Pub here, and one of the main questions that we've been seeing a lot of discussion with lately that we wanted to have the opportunity to talk about is this question of what is the role of media in suicide prevention and suicide awareness? Ty, do you have any opening thoughts about that subject? Specifically, like with media, we've had a lot of recent stuff happen in this year, in 2017 that has brought this issue to the forefront. Do you have any particular thoughts that you want to share about that?
Oh, amen, Sky. I mean, we had kind of earlier in the year, 13 Reasons Why was a series that gained a lot of attention on Netflix and really brought this talk about suicide to the public attention. We had the chance, actually, recently to sit down with Alison, who works at the North Dakota Department of Health, and discuss this issue of suicide prevention. And she is a suicide prevention program coordinator there at the Department of Health. And we discussed these issues of suicide and kind of what tools are available to those family members and friends of someone who may be suicidal, and tools available to those who are suicidal. So we just want to kind of, to segue into that, I just want to make sure that we mention that if you are feeling suicidal or know somebody who is, make sure to take care of yourself. And we will provide resources that were given to us in the link for the description of this video.
Hello everyone, today we're here with Alison here with another episode of Ty and Sky's Health Pub, and today we're going to be covering a very important topic. Today we will be covering suicide prevention and 13 Reasons Why. And for anyone that needs any sort of resources, we will definitely also be including those in the link below. So be sure to spread those to anyone who might need them, or if you yourself are looking for any. So first of all, Alison, welcome to the show. Thank you very much for joining us.
Yeah.
Alison here is actually a suicide prevention program director here at the North Dakota Department of Health. And she has agreed to, speak with us today about some of this recent buzz about 13 Reasons Why, and also to talk more about suicide prevention in general. So I guess just starting off, Alison, so in your experience, do you see that 13 Reasons Why has kind of set a new reinvigoration of the topic of suicide prevention at the national level?
Well, I have. I've seen that the series, just to back up, the series is a Netflix series that was heavily advertised and advertised to pretty much, as I understand, anybody who has Netflix knew that it was coming out. It did appeal to young people in high school, as it features a young woman named Hannah that was treated poorly by classmates, had a really, really rough time, and ends up dying by suicide. Prior to taking her own life, she recorded different videotapes and left them for folks that she perceived to have led or caused her suicide. So that really ignited a large-scale discussion, and in fact, it mobilized a lot of healthcare or health professionals that work in suicide, clinicians, and also just folks that were concerned because they didn't know what the show was about. A lot of parents didn't know that their children were watching it on their own time, and they found out later that, I'm watching that, and it's really, I really like it. A lot of young people really like the show. It's very moving. It's very well produced as far as the music and the visuals. And there's a debate about that. I do feel that it's not maybe the most accurate representation of what goes on and the supports that are available for young people that are going through a tough time.
For those of us that might not be familiar with some of the terminology going forward, what exactly is the best, or I guess your best definition of what constitutes suicide?
The taking of someone's own life, I think, is the simplest, or ending someone's own life.
Perfect. And is there any distinction between that and who you would define as suicidal?
Well, suicidality is the thoughts and the will to attempt suicide, or thinking about suicide. So it is used interchangeably between suicidality and suicidal behaviors. People just say suicidal, but it can mean different things depending on who you're talking to.
Okay.
And what kind of causes someone to kind of lead towards those type of thoughts, leaning towards that direction? Is there anything specifically, either medical or behavioral, that kind of leads to those kind of thoughts?
Well, the most heavily researched and I think shown correlation is mental illness and suicidality. That's been looked at probably the most heavily. We know that is predisposes folks to attempt and complete suicide. But there are a lot of factors that lead to mental illness. There are a lot of factors that may challenge people in their lives. One of those things, of course, is trauma, victimization in childhood or in adulthood. Some of those things, of course, are substance use and just difficult times, unemployment. Chronic disease, pain. But the bottom line is, for everyone, it's that emotional pain or physical pain, and just wanting to escape that pain. So it's the same and different for across populations and groups.
Gotcha. So there's not any sort of specific, or is there necessarily a specific demographic most at risk in terms of having these type of ideas occurring?
Across the, as far as suicidality and suicidal thoughts, all we know is that females are 4 times more likely to attempt suicide, but males are at least twice as likely to die by suicide. And that's been attributed to the means, or the way that they go about it. Males are more likely to use firearms, which are far more likely to be successful. That is changing. More and more females are successfully completing, and that's very concerning as well. So as far as that, I'd say we know that males are at higher risk of completing suicide.
And I guess as in terms of the scope of this issue, how prevalent is it in the United States generally?
Well, it is the 10th leading cause of death, and across the United States, it ranges between 12 and 13 deaths per 100,000. In the Midwest, or in North Dakota particularly, we're closer to 20 deaths per 100,000.
And how common? Yeah, very concerning numbers. How common is teen suicide in the United States?
Well, so it really depends on how we look at that and look at the data. It is more uncommon than an adult suicide, but it is the second leading cause of death for young people in North Dakota, and is one of the leading causes of death in the nation for young people. They don't tend to die of diseases as often as other people, and that is part of the equation, but one death is far too many, and it's... So when this program was released, folks really mobilized and came together to talk about what do we need to address, and how should we talk about this issue. And we have seen in history that after a famous person passes away, if it's publicized that how they died, if it's not teamed up with protective things like a national suicide lifeline number and resources, we tend to see a significant increase in folks attempting. And the media has caught on to this and has really done a good job with teaming up news releases and information with evidence-based resources, and it's particularly the National Suicide Prevention Lifeline. So we saw with some of the more recent suicides in the media that we did not see that significant increase that we did see back, like, say, when Marilyn Monroe completed suicide. or that was in the media, whether we believe that's what happened or whatever. But
And I guess kind of bringing it back to this idea, in North Dakota it being a problem for teens. Do we find any sort of difference between both rural and urban communities when it comes to suicide?
we do. We find that in decades past, urban areas had higher rates of suicide than rural areas. But in recent years, in particular since 2000, the suicide rates in rural areas are higher than the urban areas, and in fact, that gap is widening. It seems as the years pass. A meta-analysis done by the Centers for Disease Control found that in all the data and the numbers across the nation, that the rural communities were increasing, their suicide rate was increasing at a much faster rate than the urban areas, and particularly along the Rockies.
Any idea why we may be seeing this trend recently?
Well, there are a couple thoughts, and they have one of the thoughts that have been that has been looked at and supported by the evidence is that it is correlated to the amount of distance or the proximity from individuals to medical providers and urgent care and primary care providers, as well as behavioral health professionals. And so if folks attempt suicide, they're less likely to get to help in a certain amount of time, and they're less likely to access help for behavioral health problems too. It's also been linked with some of the cultural factors of the areas, been linked to issues involving help seeking and an aging demographic that older individuals may be more likely to live and reside in rural areas, or the proportion is higher, I should say, in rural areas. And then also there is just greater access and comfortability with firearms. So when times get tough, it might be more easily attainable. And we know that folks that attempt suicide in this manner are just more likely to be successful.
And I guess, kind of following up on that, what are kind of the most common ways? So you mentioned firearms a few times now. What are the most common ways, and is that the most common way that people commit suicide, or is that the most common lethal means?
Yeah, folks are most likely, it's most common that folks will try or attempt suicide with medication.
Okay.
So stockpiling or just taking what they can get their hands on. There's different ways that people do this. But it is less likely that it'll be successful. Someone may find them, and then they may be connected to resources. With firearms is, especially in North Dakota, which I can speak to the most, is over 50% of the deaths in North Dakota. And the second leading cause of death is hanging. So one of the positive things that has come out of the research is we find that 90% of folks that actually we've intervened on and have not died do not go on to die by suicide.
Really?
So if we can prevent that death, there's accounts of folks that have jumped from the Golden Gate Bridge and have survived, and say, as soon as my hands left the rail, whether it was adrenaline or what have you, I just realized I made a mistake. And so there's accounts of that, but also there's just interventions that take place after somebody survives, and they just tend to, 90% go on to live and get better. However, of course, 10% don't. So they're at higher risk, and it's really important to intervene at that time for that reason.
And I guess that kind of brings me to another question I have. So once somebody has attempted suicide, are they more likely than someone who has not ever attempted suicide to attempt suicide again in the future? Are they always considered suicidal throughout the rest of their life, or how does that typically tease out?
Well, that's a good question. They are at higher risk than other folks, and in particularly within 24 to 48 hours after discharge. So one of the things that's been put in place in North Dakota and in many states across the United States is interventions and follow-up callback supports So in some communities, we're talking face-to-face follow-up, and folks even coming to homes in mobile crisis units. But in most cases, we're looking at people just calling that individual and following up within a few hours of discharge to see how they're doing, and to make sure that they have the resources they need, and to talk to them about safety planning, and to make sure that they're following through with their safety plan and their supports.
Just in terms of the resources that you spoke of, very, very important to get access to these resources. Do you find that to play with this idea of stigma, does this idea of that the stigma surrounding suicide and mental health illnesses in general, do they prevent people from accessing these resources? Do you think that there's a larger stigma, not just society as well as, but in the family unit as well?
Yeah, this one of the things that has come up for me working with either corporations or contacts, wellness programs, there is a concern by employees, especially people working in professional positions, that if they go and seek assistance through the wellness program, if they're going through a hard time and use even their free, work endorsed 3 sessions, what is that called?
Oh, yeah.
It's on the tip of my tongue, but they may not do so because they're afraid that information will get to their employer, and that they'll especially if they get a diagnosis through the treatment process, that will be evidence that they are not fit for their employment. We see that with the military, that they might be afraid to seek help. We see that also we see that with young people in rural communities. People are, of course, afraid sometimes to go to the rural or the human service clinic because somebody might see their vehicle outside.
And I heard you mention a little bit earlier about a safety plan. Could we have you go into what a safety plan is and kind of what's involved in safety planning?
Absolutely. So individuals that, whether they work with a crisis worker on a hotline on the phone, or they go to an ER, or they go to a behavioral health clinician, one of the evidence-based or proven practices for folks is a safety plan. And that really is something that's supposed to be completed in partnership between the provider or the person, the helper, and the person at risk. And it asks them to think of people in their lives and supports that they could utilize. It provides them with information on the crisis line and local resources that they could attain in the community. And it looks at different warning signs that they experience. Some people, maybe it's when they're alone that they start feeling sad. So it might ask, how do you know that you are maybe feeling badly or feeling sad? How do you know that you're feeling suicidal? And then they'll write out what those indications and those warning signs for them to look for. Also, it's a tool with which helping professionals can contact family members with the approval, of course, of the patient, and get them involved to say, how can we support so-and-so in getting better and feeling better? What do you think would help you feel better? And then part of that, and a very, very important part, is removing lethal means from the home. Looking at that plan that they had for suicide attempt and looking at how can we prevent this from happening. And so that might include removing firearms from the home, ligatures, medications. Of course, ligatures are more difficult than other things because there are more options of ways that people could try to do that. But I think it's still worth doing, removing all of the lethal means that folks think would be a feasible method for someone to complete or attempt suicide. And then, of course, to look at supervision. For some people, psychiatric inpatient treatment is the best choice, but for many people, it's not. And so how can we care for people in their own environments? Because what we find across the country is that people are inpatient, and they may not feel like they fit. Maybe they have, maybe they they're being treated with other folks they don't identify with that struggle with different issues. And then some of the professionals that they work with may not fully understand suicide because we still have some educational barriers across the nation. A lot of medical professionals and behavioral health clinicians even aren't trained thoroughly in the best practices and evidence-based practices for suicidality. So some inpatients, they'll get discharged and they feel like the experience was not as positive as they would like it to be. In other instances, they've had a great experience, but it's just one of those things that it's not appropriate for everyone to be in inpatient care.
Is there possibly any sort of generational gap of about what's occurring for individuals? Like, are we seeing more now if trends are going up? That if it's in terms of our kids more likely now to search for resources as they were 20 years ago?
Oh, I do actually. I believe that things are improving as far as young people reaching out. I am very heartened by some of the things that I see. I think a lot of school programs. One of the programs that I endorse is Sources of Strength, which is a very very positive, strength-based, oriented, evidence-based program for young people, and it encourages adult-youth relationships, which is very, very protective. So that's really positive. I think a lot of school cultures are changing and changing for the better in regards to help seeking. I do think we have new barriers that people are not equipped for in education. Young people maybe aren't equipped with coping skills and may not have may not know how to cope with some of their feelings. And especially when we look at online bullying, when we look at some of the things that folks face that they didn't face before, it's just reminds us that we need to be having those conversations with young people and really making sure that every young person knows and feels connected to an adult that cares about them, that they feel they can trust. And so that's something else that we really try to encourage in the schools is adult young people relationships.
Well, yeah. I mean, I feel even since when I went through high school and all that, more and more time is spent kind of online so that harassment can be really public. Whereas before, it could maybe be amongst a smaller peer group, but not kind of out there for the whole world or your whole school, like is shown and covered in the series. In your opinion, and kind of from what you've come across in researching this topic, do you feel that 13 Reasons Why, in its dramatization, romanticizes suicide?
Well, it certainly draws in the audience, and young people do identify with the character Hannah and some of her difficulties. So in that respect, I would, whether that's the language I would use, I would definitely say there's something that is potentially risky about the production. And I think, I just think back of when I was in high school, Sex and the City was big. And one of my classmates, very smart, a lovely young woman who's like a graphic designer now, but she started smoking because she identified with the character Carrie Bradshaw, and she continues to smoke to this day, cigarettes. And you think about that.
Yeah.
And you think about that with suicide. Somebody identifies with Hannah, and we see that. We see young people attempting and making reference to the film in some instances. And I certainly think that it has fostered a discussion, and there probably are good things that have come out of it. And unfortunately, we don't see those things. They don't rise to the surface. And so I think it was a well-intentioned film and production made out of a fictional novel. And it was very moving. But unfortunately, there has been a fallout from that, and young people have been harmed. And we see young people, accounts of young people saying things like, well, Hannah did this, and her life was better than mine. Why, maybe this is the right answer for me. This is something that I should do. And some processing of young people. Luckily, after surviving an attempt and things like that. So it's a real phenomena, and it's something that we need to pay attention to. And we also just need to remember to have that discussion with young people, because especially if we don't know what kind of media they're consuming and what kinds of things they're exposed to.
And I guess we kind of find ourselves with this issue at the intersection of media and public health in general. One thing that you mentioned a little bit earlier and has been referenced in other talks we've done is that oftentimes with public health issues, it will take some large kind of negative event to take place in order to shine light on this event, like you mentioned, Marilyn Monroe's suicide, to shine light on this event and get kind of the public to even start discussing this event, and we can move forward and come up with new solutions. And that kind of kicks off maybe just that discussion kicks off maybe innovation, or even just more of a consensus and more general knowledge being passed about the subject. Do you see shows like 13 Reasons Why that cover issues that are hard to cover, like suicide? Do you see those as kind of functioning in some sort of a way as this very negative event without it being a real-world event? So I guess, does it kind of take the place of that real-world event in spurring that conversation? Can it function that way, or...?
I have to believe that it can. I have to believe that that this can function as a catalyst for something positive. We did in the immediately after it was released. I mean, folks that knew that I did, as the director of suicide prevention, were like, you need to watch this film. This is right up your alley. You're definitely going to need to see this. And that's, how I became aware of it, because I didn't have Netflix. But, and so it was already in the discussion majorly in my life. And then, so I don't know if many people could escape it if they had Netflix. I think it was all in their feed. But, so I think it definitely can operate as sort of a catalyst for the discussion. It certainly mobilized a lot of behavioral health professionals that are interested in this topic, and a lot of people that happened to already have the insight. Unfortunately, not everyone had the insight that these media events can have huge impact on vulnerable persons and young people.
Do you feel that shows like 13 Reasons Why, even though, you spoke before that young people are very susceptible to what's being displayed, and if they relate to a potential character, then they're more than likely to, adopt behaviors of that individual. Do you find that also, in your opinion, do you feel that it's also the same for people of other demographics as well, other age groups, that if you're older and then you still watch something like this, do you think that the same effect still applies if you're still not going through, say, if I was in high school watching the show versus not being in high school?
Mm-hmm. I do believe folks can identify even in adulthood, especially if they're vulnerable, if they're not, if they don't have the supportive relationships that really allow them to have conversations about some of the things they're experiencing. I think that's the most harmful. Folks need supportive, healthy relationships. And when folks get isolated, when they start feeling that they're a burden to others in their lives, and then something like this comes about that they identify with, in particular if they've had similar experiences, like some of the harassment or violence depicted in the film or this series, they might grab onto that. And so I think, as the more similarities that they see and the more they identify with that character and the more isolated they are from really bouncing ideas off of healthy folks in their life, the more at risk.
Hello, Ty and Sky from Ty and Sky's Health Pub here. Are you an event organizer looking for a way to take your event to the next level? Well, we also do live podcast events with real health experts about the health topics that matter to your community. If you're interested in having us come out, follow the link and let us know.
Have a good one.
So we've gone through a little bit about some risk factors. What are some major risk factors for suicide?
So some of the key things to pay attention to, because there are many things that can function as a risk factor: age, as we talked about, living in a rural setting, being male. There's a lot of things that could be risk factors. But some of the things that I would say to pay attention to and take action on is folks that are isolated or isolating, folks that feel like they're a burden to others, folks that have access or are stockpiling means to with which they could complete suicide. Any veiled or any comments about falling asleep and not waking up, veiled comments about death and suicide are somewhat predictive, and so we want to pay attention to that. Those would be some of the key changes in sleep, changes in behavior, irritability, but also just really changing and having a more positive attitude. So any of those major changes, giving away possessions.
So you mean like just to clarify, so after somebody is maybe having kind of a negative attitude about something, just kind of a complete 180 can be a sign or
Right.
risk factor. Okay.
Right. Yeah. That sudden change is very concerning. So if someone's on your watch list, for so to speak, and you're like, I'm really worried about so-and-so, and then all of a sudden they make a change, you're going to still want to watch them and keep in mind that they may be at increased risk. Maybe ask them some questions and see how you can support them to feel better. And they may be feeling better, and that's just the confusing part.
Is there anything in addition to just asking them questions that someone can do to kind of help assist if someone is experiencing? Because I know there's a degree of people that say, well, is it my place to get involved in someone else's personal life? And
Right.
it's a kind of a fine line that we kind of walk. But in which ways is it acceptable to kind of breach that to try to ask someone to help? Is there anything that we can do if we do know someone suffering any of those types of thoughts or any of those symptoms?
Yeah, absolutely. If you're concerned about somebody, I think it's always appropriate to ask them a direct question. Are you thinking about suicide? You can ask, are you thinking of harming yourself? Folks that are survivors will recommend that if you ask them, are you thinking about harming yourself, to also follow that up with a more direct question, because some folks that are suicidal may not perceive that as harming themselves. They're like, I'm in pain, and ending my life is a relief from that pain. So certainly follow up with another question if you ask that, or ask if they're thinking of ending their life. There's always a chance that someone could maybe give you a little bit of attitude or something like that. But most people, by and large, are going to really appreciate you asking, and it may even be a relief for them that you've asked. And one of the things that I like to do is to preface that with, a lot of people that are going through what you're going through have thoughts of suicide. Are you having thoughts like that? Are you going through this? Something like that. Something to normalize it on the front end.
Well, yeah, and I like the fact that you really made that distinction between asking about, are you thinking about harming yourself, and getting more specific with suicide, because I think it can be really maybe uncomfortable at first, and if you're not the one who's experiencing those feelings and thoughts, you may not make that distinction like you mentioned. So to somebody like me who may not be going through that, harming yourself and suicide may be one and the same. But it's, I think, very important, because I did not know that before you mentioned that to that other person, harming yourself may be the exact opposite in their mind. Because like you mentioned, they're freeing themselves of that pain. So that's a very good point.
And as far as I guess a lot of the times when suicide's talked about, we talk about mental health issues. We talk about depression. In your experience, then, a lot of the time, because I've even seen just from online different things. If you do know someone with depression, or if someone's very open about depression, that sometimes that direct interventions are not always preferable. That it's more likely to just be there in the room with them, or just to be present to let them know, hey, I'm here for a discussion. Is it kind of more of a balancing act then in that way with regards to if you are watching out for someone to commit these acts, and then if they are balancing depression, in addition, like to know when to, I guess, to learn the communication skills of when to approach someone and when to give space?
Well, that's a very good question, and I want to keep it simple because I don't. The most important thing that any of us have is our relationship to each other, right? And I think that trust is just really key. But whoever it is, if you're worried about somebody, asking the direct question is important, but listening without judgment and just sitting it out, being present with them. Certainly not being pushy. Thing is as long as you're there and you're talking, things are okay. If you receive an affirmative from them where you're concerned, then what I recommend is staying with them until you can connect them with some kind of help, or making sure that you don't leave them and stay within a line of sight.
And just to delve just slightly further into that. At what point, because I know that for a lot of viewers, though, if they are experiencing this firsthand or they're dealing with someone who might have suicidal tendencies or thoughts, do you think that for those situations, such as, when the boy who cried wolf, right. Do you think that we need to pay, I guess, more attention to those scenarios where people are constantly reaching for it, even though people might think that it's not, like that it's just a reach for attention? Do we need to still be very vigilant in those situations?
Right. So you may be referring to folks that have chronic mental health disorders, or perhaps have received specific diagnoses that people associate sometimes with suicidality, and they feel like, they're always attempting or always talking about suicide, and it just doesn't happen. And definitely we find that those folks do complete suicide more often than other people. I don't want to say any specific diagnoses on the air, like to promote any stigmas that already exist, but it's absolutely folks that talk about suicidality and have had previous attempts and are at increased risk, and we need to always respond to them as the crisis that they are. There are individuals that have gone through a lot of difficult things. Folks that have experienced traumas, folks that have very difficult mental health or chronic disease disorders. Lots of different things. And sometimes those are exactly the same vulnerable individuals that get marginalized and treated as though they're not deserving of help. And so that's just something to keep in mind, that folks are in a great deal of pain if they're talking about suicidality, and we need to respond to them as the mental health crisis that it is. Yeah.
And I guess, do you feel that Hannah's situation, the way it was portrayed in the show, was that kind of uniquely negative for dramatic effect, or do you think we see that play out in high schools across the nation?
So I tend to believe, I've seen a lot of difficult, tough stuff. A lot of young people do go through some tough things. They're victimized in some cases, or assaulted, as you see in the story. And but one of the things that I think is not fair and balanced about the show is that it shows people that are burnt out and not willing to help, which is not the case. I think most people that are in helping professions or that work with young people want more than anything to help those young people, and that's their passion. They're not getting paid the big bucks, so I think they really are there because they care. And young people are resilient, and there are many, many young people and adults that seek help, get a treatment that's effective, and they get better. And we just don't see enough of that. And so I'd say probably my biggest challenge to the media, and then the production in it. My biggest problem with the production is just that it didn't show that balance of hope and help and resilience. And so, I meet people every day that are survivors and have gone through difficult things like Hannah did, and they are very powerful professionals, very powerful people that do great things, and because they sought out help and they were resilient and they fostered those healthy relationships.
I guess along those lines too, but maybe more generalized, what are the biggest misconceptions about suicide that you come across?
Just that there's nothing we can do about it, and that people are going to do what they're going to do. That's the biggest, most important, I think, misconception. The actions that we take do make a difference. We see that on a national level and at a statistical level. And there are some people, perhaps, that we are not able to prevent what takes place. And I want to acknowledge the many survivors that fight for somebody and they lose them. And it does happen, and it's a tragedy. But that doesn't mean that we don't save countless lives by our efforts. Also, we see that in centers that implement and communities that implement the zero suicide, which is a comprehensive, systematic approach to suicide where everyone is screened for suicidality, and they turn up twice as many people as they would by traditional means. Everybody is screened with an evidence-based screener. They use evidence-based assessment tools. They use brief intervention like safety planning that we discussed, and removing lethal means from the home, bringing in family. Well, some of the things and misconceptions about that is that we can't involve family because of HIPAA and all that. And certainly we want to talk with our patients, and we want to have that discussion and make sure that it's safe to bring in family members. But by and large, it's if they agree to it, it's and they don't have an abusive or unhealthy relationship with these folks, it's beneficial to bring them in so that we can plan to remove lethal means like firearms from the home, so that we can plan to look at ligatures and plan to look at what kind of supports do we need in place to make sure that you're healthy. Some people, when their sleep gets out of hand, or they're not seeing their support group, or they're not going to their appointments or taking their medication, that's when things start to fall apart for them. And so it's just really important to, for folks to get supports around them to reinforce whatever safety plan they put in place. And then the last components of that that are worth mentioning is that providers then have a relationship with a behavioral health clinician or somebody that they can do a warm handoff to if the situation warrants it. And so that individual can get competent care as soon as possible as a priority. And then, of course, be placed in psychiatric treatment if necessary, which sometimes it's not. And then to set up these follow-up caring contacts, which are can be arranged through the National Suicide Lifeline in North Dakota, many healthcare providers have an arrangement already set up with the provider agency First Link. And so they'll provide caring follow-up contact through calls and letters, and can even, send someone to the home in some circumstances in some communities. So.
And I guess in terms of like some of the school programs that you've talked about, like, do you think that schools need to take a very strong-armed approach towards this issue, that they need to be like fully involved in kind of pushing the boundaries of this happens at home, this happens at school? Like, I guess in more terms of, like you said before about how the family unit, like we might bring in the family or not. Is it something that we want to kind of press and get more families involved at the school level, or in terms of kind of this being on awareness in terms of like bullying and things of that nature?
Well, I think meaningful and thoughtful policies and protocols do make a difference. I know that our schools are, they care about their young people in North Dakota, and I'm guessing across the country, care about their young people, and they want to support them. And I think there's a lot of fear as to how far is too far. So I think looking at the best practices available through the American Foundation for Suicide Prevention on suicide, and some information on bullying prevention, looking at the Suicide Prevention Resource Center, they have really some good tools. Checking with local health departments for in North Dakota, then the Suicide Prevention Program, but also the Department of Public Instruction, to see what's available. I think one of the problems that we have is that schools just, they don't feel that they have time, and they don't know what kind of resources are available. And there's actually a lot of supports that are available for free in some communities or in some states. In North Dakota, we have free programming, free trainings that can be accessed. So we have a free comprehensive suicide prevention program available to schools right now called Sources of Strength, and it's been proven to impact risk and protective factors for suicidality, substance use, and bullying. So involving some caring educators in that program and getting the youth involved, that's one of the key components. And really supporting their coping skills and increasing the protections in a school, as well as just informing them through the program of what resources are available in the community, can be really powerful, especially when teamed up with policies and protocols that are effective.
So kind of with this aspect of environment and community engagement in terms of being involved in someone's personal life and, being their support network, do you think that in terms of, getting back to writers and editors and people involved in media, do you think that there needs to be more responsibility on how people, like you said before that you've worked, that in terms of working with like news networks, it's been getting better. But in terms of even like literature, for example, do you think that there needs to be that, say, a writer needs to be more aware of that subject matter if they are breaching it, and that they need to do their due diligence towards approaching that topic?
Well, certainly we don't know what we don't know. And so if folks don't know, they just don't know what they don't know. I like to believe that everyone has good intentions, but the information's out there. The media toolkits for suicide is out there. There is information, and I have disseminated it locally. I feel like people in North Dakota are really working hard to send messages out with teamed up with messages of hope and help, and then the National Suicide Prevention Lifeline and other resources. But as we see, there's also as another side where folks maybe missed that. So I do think there is, I'd like to encourage a responsibility to seek out those resources, or even contact me for those resources. But there are lots of resources on the SAMHSA Suicide Prevention Resource Center, and the Suicide Prevention or Zero Suicide Toolkit has resources. And so some of those resources can be accessed to kind of get a handle on that. By and large, what it encourages is to team up any discussion of suicide with that information, the crisis information, to not shy away from talking about the issue in a productive way. And certainly that's not the point. We don't need to go into detail about how somebody completes suicide, and it's more important to talk about the people that maybe have thought about suicide and don't complete suicide, the people that have actually sought out help. And so we need to see more of those stories covered. I think people would respond well to it. I think there's I think people would consume that kind of media. I think they'd like to see stories of resilience and people who really went through hard times, but look at all of the things that they've done now or the road that they took to feel better. Because there are a lot of people that are in pain and that are hurting that would, I think, really like to hear about how did somebody else do it? Because I'm not feeling good, and I really want to know how someone else turned that corner. So,
are there any tips or ways that adults can approach talking to children, either their children or other children, about these issues, about suicide prevention?
Right. Well, as we discussed earlier, this series, is very discussed. Most young people are going to know about it, so that it is one way to get the discussion going. If you're a parent or you're someone that's involved in young people's lives, you'll want to know if they're watching the program. You'll definitely want to know what their thoughts are on it. So that is certainly a way to get that discussion going. And to ask about how they're feeling about it. Do they identify with it? Do they feel or perceive that it's realistic? So that's certainly worth asking.
And do you think that this is something that we should have all parents doing for all children, or is it kind of a situational discussion?
I think that parents absolutely should be having the conversation with any young person that might have access to the Netflix series. I think conversations and that relationship building is so important and probably the most effective, protective resource we have. There are a lot of awesome programs. We talked about Sources of Strength. We talked about Zero Suicide Initiative. And First Link's callback program. There are lots of great tools, but those relationships and the healthy relationships between young people and adults is essential.
And is there a certain age where a child is too young to be kind of approached with this topic or this discussion?
Well, what we find is that young people, it happens. I mean, there are young people that complete suicide that are within the 10 and younger range, but it's highly rare. The important thing for those young folks is not so much to be talking about suicide, it's to be talking just with them frequently, building that relationship that you can call upon later, and really just build that trusting relationship. And luckily, and what I tend to find, especially the younger you go, if there's something that's on their mind, they might, just tell you because they're young enough still.
Yeah. Oh, exactly.
So I guess in terms of, because you bring up an interesting point that, if they bring forth this information kind of like willingly, or just they're not hiding it behind any sort of social stigma or anything going on there. Do you think that that constant positive reinforcement is the way to go in the future with this discussion, that as long as we keep reinforcing positivity and that people, that there is help out there for people, that's going to lead to better outcomes for people?
All right, that is a good question. I'd like to make the distinction between, between like building self-esteem and self-compassion. I think one of the other traps that we fall into is building this, is trying to tell young people, you're the most wonderful. You can do anything you want to do. And that's true. We can want to keep their mind open as to what they can do and tell them but it's more important to tell them how important they are to you, and to keep it within the realm of how they to encourage them to keep a learning mindset and an open mindset. One of the traps that we fall into is that we might raise their expectations, and if they get the B in class, they might fall into, I thought I was smarter and I guess I'm not, and all of this. And so one of the ways just to sort of avoid that is to keep it within the realm of positive social norming, encouraging positive social behavior, as in terms of activities, positive friends, and trying to keep shame and shame language out of our vocabulary, if that makes any sense.
Well, and I think you hit on an important piece because I feel like there's this idea that being told you can do anything, maybe kind of like a hand wave thing, where talking about building personal compassion, feel like that's really working to build a link between you and this other person. So it's not seen maybe by that other person as just kind of a hand wave, oh, that's what you say because you're my mother. But maybe reminding you that you do mean a lot to that person. So I think that's a very important point. Just one thing that I want to make sure that we covered. Say that somebody who is listening to this is having suicidal ideations, feeling suicidal. What is the first step they could take to help themselves?
No matter where you are in the United States, you can call the National Suicide Lifeline. And since I'm based in North Dakota, I can't speak exactly to all the resources. In most states, you'll be connected to a local center that'll have access to local resources, or more local resources, or can tell you how to access those resources.
Well, thank you very much, Alison, for joining us today. I know that this is a very difficult subject to talk about, but also a very, very important subject to talk about, especially like we've been discussing today, when given the option on such a grand scale that is maybe brought up by a show like 13 Reasons Why, where we're already primed to maybe discuss very complex, very difficult subjects. And I hope that, kind of like we've talked about too, we can see some of those good things come out at a state level and a national level as a result of this, maybe opening the door for some of those conversations. But before we let you go, we just want to ask you, or I have one question that I just wanted to ask you, kind of a random question, but if you could change the color of the sky and the color of the grass to any color, what would you change them to?
Oh my gosh, who would do that? I'm a runner. I love the way, like, it, I guess I don't care for gray days or days that are like,
yeah.
But mostly, by and large, I wouldn't change a thing.
Good answer. Well, perfect. Well, thank you guys for joining us today. And again, thank you, Alison, for joining us here.
Thank you very much.
Thank you for having me.
Oh, of course. And we do really invite your feedback on this. So if you guys have any questions, anything that you would like us to address in maybe a future episode dealing with the issue of suicide or suicide prevention, please let us know. Thank you guys for checking out that video. If you'd like to see full health interviews with health experts, you can click or tap on the side. If you'd like to see Health Bits, which is our reactions to different health events, health news, and other goodies, you can click or tap on the side as well. If you haven't already, click subscribe below, leave some comments, likes, let us know what you thought of the video. If you want to receive video updates just as soon as we release them, make sure to click the bell down below. Also, a special thank you to all of our pubbers. If you'd like to become an official Health Pub pubber, you can check out the link below to the Patreon page.
A toast
To
knowledge good and true, to the future health of youth and the prosperity that they bring. Cheers.